I think the most important thing to me is that the sense of community that these communities have. I worked in a more isolated station before I come to PA, and everybody was very good to the health center, and we got to know the people where they lived, and knew their children and their grandchildren, and it's a real sense of community and getting to know your patients very intimately as compared to when you work in an emergency department or in a hospital where they come and go. So that's always been very important to me, and to just care for the whole person. Like, we try to encompass all the not just the medicine wheel, but all the different things about caring for people, like the holistic and the spiritual and physical, and it just really resonates with me how important that all is. So I graduated from the diploma program at Kelsey here in Saskatoon 43 years ago, and then I subsequent to that I did my Bachelor of Nursing. I've worked in the North practically that whole 43 years. I've always worked on First Nations reserves, and right now I'm the clinical nursing supervisor for Peter Ballantyne Cree Nation, so I'm at a second level manager position, and I look after 3 nursing stations for the band, and that includes Pelican Narrows, Deschambault Lake, and South End. Probably within the first 3 weeks or a month, we recognized that we were missing a huge window of opportunity to get people contact traced and have people isolated and to stop the spread. It became apparent very quickly. So all of the health centers that I'm involved with are very isolated. Pelican Narrows being the furthest away, and it's about 4.5 hours from Prince Albert. So it involved, when we first started doing the testing, we had to send our samples either to Flin Flon if we were in Pelican or Deschambault, and it took so long for Manitoba to get our results back. And then if we sent them to Prince Albert, they in turn had to send them to Regina. So it was a lot of lag time between doing a swab and finding out somebody was positive. So we were losing a fair amount of time before we had a positive result and could start the contact tracing. So I, in collaboration with NITHA, we had heard that these GeneXperts were available for through First Nations and Inuit Health for isolated health centers, so that we would have a better a time, like rather than wait 4 or 5 days for a result, we could get them in 45 minutes. And it worked out very well. Like, we were able to start our contact tracing within an hour of it being positive, and we had a very positive impact on getting people to isolate better and to stop the spread of the virus. And then the other barrier was the housing conditions on the reserves where I work. They're very crowded in most places. So if we had one positive case, generally we had 6 or 7, and some of the houses even have 20 people living in them. So that was another huge barrier. And then the other part was that many people on First Nations are very distrustful of new vaccines, and then with all the rhetoric and stuff around the COVID vaccine, it was a huge challenge for everybody involved. Most of the elders have been very cordial in getting their needles and encouraging the other population from 30 to 60 into getting the immunization too. So lots of the nurses have been in these communities for several years, so they have a really good rapport with the people. So when we decided to go door to door with immunization and stuff, we had that level of trust that people would let us come into their homes and work with them on the immunization strategy.